Have you ever thought about doing chin liposuction but were worried about the scar? Hi, I'm Dr. Dominic Castellano, Elite Facial Plastic Surgery, and today I'm going to focus on addressing the chin liposuction scar. So, when you're doing chin liposuction or submental or neck liposuction, you obviously do need to make a small incision. That incision is normally about 3 to 4 millimeters, which, to give you some reference, an eraser head is about 6 millimeters, so it's very small. After having the procedure done, normally 2 sutures are going to be placed. Those sutures are either going to be what are called permanent sutures or absorbable sutures. With permanent sutures, they normally come out after about a week. With the absorbable sutures, they will sometimes fall out after a week, if not another week later. You can also always come back to the office and just have us remove them. But once those sutures are out, normally you will feel some firmness, and then that firmness will take some time to settle. What I normally recommend patients to do is you can hold your finger on the incision and hold pressure there for about a minute, 3 times a day. I don't recommend doing it more than that. And normally you're going to start doing that after about 10 days and maybe up to a month. Now, once the sutures are out, I also tell patients that when you get to about 2 weeks, if you want to, you can utilize silicone's sheeting or some vitamin E oil as another option to help facilitate the healing process. And then what ends up happening is the incision, anywhere you have an incision on the body, particularly the head and neck area, is going to take about 6 months to fully mature. The one thing you can do to facilitate protecting it while it's maturing, especially where I'm at in Florida, is to apply some sunscreen. If you're going to be at the beach for an extended period of time, make sure you're applying that sunscreen regularly. And then what you'll find is, the incision will heal at probably at monthly intervals, but normally it should be fully mature at 6 months. Sometimes patients also will experience a little bit of pinking and maybe a little bit of darkening color, but that too should settle out over time. Certainly, in my practice, I have my patients follow up to monitor and make sure it's healing up well, but if you have any questions about it, I'd recommend that you follow up with your surgeon to discuss. What is the best way to minimize the appearance of a chin liposuction scar? Patients are often inquiring what they can do to minimize the appearance of any incision and to prevent scarring. The first thing that I recommend is following your surgeon's instructions. The other part to this is, depending upon the type of suture that is placed, you're going to need to follow up to maybe have that suture removed. And then upon your follow-up and getting those sutures removed, and if they're absorbable once they fall out, things you can do to improve the appearance is either utilize silicone sheeting on a nightly basis. You can also apply some vitamin E oil if you'd like. And then the other trick that I usually recommend patients to consider is applying a small pressure on the incision for about a minute, maybe 3 times a day, from being about 2 weeks out to about a month. Now, the things that you can do to prevent an incision being visible and developing a scar is, things that are, I think, are relatively common sense, i.e. try to eat well, avoid smoking, obviously don't pick at it or manipulate it. And then the other part is, with living here in Florida, is to be wearing sunscreen while it's healing. Are there any alternatives to chin liposuction that don't leave scars? And the 2 things that come to mind that can help improve this area is, number one, there is an injectable treatment called Kybella that can be utilized to help improve this area. The other component, or the other option, could be consideration of one of the surgical interventions, such as school sculpting. Now, realize, depending upon which one you choose, they both have pluses and minuses. In my opinion, I don't believe they're going to be as definitive as a surgical procedure, but the benefit of them is that you don't normally require, anesthesia with an additional provider, and the downtime should certainly be minimal compared to from a surgical standpoint, and you obviously don't have the risk associated with a surgical procedure.